Many people rank going to the dentist as one of their biggest fears. Every day I'm in my office, there are very few people that are happy to see me. Look man, nothing personal, I just hate seeing you. Outside of work, no problem. But in here, big problem. And I get it, even I don't like getting my teeth worked on. I had to get 4 of my premolars taken out before I got braces because my mouth just didn't have enough room for all my teeth. And that was not fun. So hearing from the dentist that you have a cavity and you need to get a filling can be a problem for a lot of people. I mean, why would you want to go to the dentist more than you already have to and have people poke around your teeth, put their fingers in your mouth, spray water on your face? So do you really have to go? I mean, is there a way to just get rid of that cavity at home naturally and not have to go get it drilled out and put a filling in it? I'll give you the short answer. Sometimes. I know it's a little confusing, but in a nutshell, if the cavity's really big, then no, you have to get a filling. But if it's really small, then you got a chance. But the good news is you don't all of a sudden wake up one day and have a giant hole in your tooth. But that's exactly what a cavity is. Well, it's not always a giant hole, it could be a smaller hole, but a cavity is a hole in your tooth. And it's not produced by the sugar that you eat. It's actually produced by acids. So you have this bacteria in your mouth called Streptococcus mutans. And this bacteria will eat the carbohydrates in your diet and the sugar in your diet. That's why dentists say stop eating sugar. And in turn, this bacteria will poop out these acids, this lactic acid that will sit on your teeth. And eventually this acid will damage your teeth to the point where you get a hole in your tooth. Now that hole only really forms when it gets past your enamel. So you have your enamel, which is the outer portion of your tooth, and then the inner portion is your dentin. So as that tooth is getting weaker and weaker from all those acids, those bacteria are getting deeper and deeper inside the tooth, and eventually they'll get to the dentin, the inner layer of your tooth, and then they'll keep going from there until they get into the center of your tooth. This is why a filling is done. So a filling is done where the dentist will take this dental drill and drill out all the decay, because what he's drilling out is basically all the decayed tooth structure. You can't save that anymore. So he's removing all the decayed tooth structure and keeping only clean tooth structure. Once all that decay is gone, then he puts a filling over it to make it look like a brand new tooth again. So your teeth are constantly in this state of remineralizing. It's kind of like your bone, where you have these osteoblasts and these osteoclasts, which will deposit new bone and take away the old bone. With your teeth, you have enameloblasts and enameloclasts, which will do the same thing. But instead of depositing new bone, it's depositing enamel, or the outer layer of your tooth. But sometimes this balance of demineralizing and remineralizing gets off. And if your demineralizing gets higher than your remineralizing, then you're going to be taking away more tooth structure than you're going to be putting back. And eventually that tooth will get so damaged that it needs to be repaired. But as that demineralizing is occurring faster, this is the start of a cavity. And when a cavity is just starting off like this, it is still reversible. And I'll see this all the time. And this is actually what part of the dental checkup is for. For example, if a dentist looks at x-rays and sees a little spot forming in between the teeth, that could be the start of a cavity. Because on an x-ray, cavities will show up as radiolucent or darker, but your natural tooth will appear more opaque or more white. So if a cavity that is forming is still in the enamel or the outer layer of your tooth, then it's still reversible. Because at this point, it hasn't formed a full-on hole yet. It hasn't basically penetrated that outer defense of your tooth to get into your dentin. This can be still reversed if you start having more remineralizing and less demineralizing. You can start to balance that out and build up that enamel and strengthen it so that cavity doesn't get any worse. But once that cavity passes that enamel and gets into your dentin, the inner layer of your tooth, then you have a full-blown hole. And this cannot be reversible. You might have heard of something like oil pulling or some other method out there right now. There's no evidence that that works to reverse a cavity once it gets to this point. The only thing you can really do is get a filling. It cannot be healed naturally. This is a big deal because once the cavity gets into the dentin, then the bacteria will enter the dentin and it'll start spreading faster. A lot of times this hole that's in your tooth will look really small from the outside, but once you get in the inner layer of your tooth, in the dentin, then the cavity appears a lot bigger. The reason for this is the dentin is weaker than the enamel. So the cavity has a hard time penetrating through that hard enamel. But once it gets to the dentin, which is a lot weaker, it's easier to spread. It's like a field day for these cavities. And if you leave it alone, these bacteria will make kind of a beeline straight to your nerve in the tooth. The nerve, or the pulp, is the center of your tooth. This is what carries all the blood supply and the nerve endings of your tooth. And once a cavity reaches here, then it can be really, really painful, and it can also cause an infection. So your goal should be to stop this cavity in its tracks before it reaches your dentin, so you never need to get a filling or any work in the first place. So why does this demineralization happen? Well, we already talked about it a little bit before, but it only happens because of one thing. Again, it doesn't happen because of the sugar that you eat or because you didn't brush or floss enough. It happens because of acid. Your enamel breaks down at a pH of 5.5. So if something is more acidic than this, then it will start to demineralize your enamel. And your dentin will break down at a pH of 6.5. So that's why once this bacteria gets inside your dentin, it has a much easier time of spreading and eating away that dentin because the dentin is so much weaker. So what acids will damage your teeth? We already talked about this strep mutans, which will eat your sugars and then poop out this lactic acid. But you can also get other acids in your mouth. For example, if you have GERD or acid reflux, that's when your stomach acid will go back up into your esophagus. This can actually change the pH of your mouth and make your mouth more acidic. And having a more acidic mouth will make your teeth just more weaker and make them easier and more susceptible to get cavities. Because even though we know that your enamel breaks down at a pH of 5.5, if your mouth already has a pH of, let's say, 6, it's so much easier for your mouth to get to that 5.5 pH. And that means you're gonna have a lot more demineralizing. Whereas if your pH in your mouth, let's say, isn't 6, it's actually 7, then it's gonna be harder for your mouth to even get to that point, that trigger point for your enamel to start breaking down in the first place. So if you have a condition like GERD and you haven't really had it under control ever, try going to your physician and see if you can get that under control, because it's not just your stomach that it's affecting, it's also the rest of your body, including your teeth. We also get acid from our drinks. Pretty much any drink other than water is gonna be acidic. So that means anytime you drink your coffee or your soda or your juice, you're introducing this new acid into your mouth that's gonna further lower the pH and make your teeth more in a demineralizing state. You can also get more demineralizing when you have less saliva. Your saliva is like a bodyguard or a buffer for your teeth. It'll buffer out a lot of the pH. So if you have a really acidic mouth, but you have a lot of saliva buildup, then the saliva will kind of even out the pH and make your mouth more of a neutral pH. Your saliva also has a lot of antibacterial properties, and it can wash and clean away a lot of the plaque and bacteria on your teeth. One reason people can have low saliva is if they're always mouth breathing. So if you go to sleep and you wake up with drool on your face and your mouth is really dry and it's been open, that's a sign that you're mouth breathing and you're drying away all the saliva in your mouth. That's gonna make you more susceptible to get cavities. So one thing I like to do is tape my mouth shut before I go to sleep to encourage nasal breathing. Now, there's a whole list of benefits from nasal breathing as opposed to mouth breathing, and I'm not gonna get into that in this video. I did make some other videos on it, so I'm gonna put a link in the description below if you wanna learn more about it. But if you combine all of these things with bad habits, like having a bad diet, eating a lot of carbs, frequently snacking and sipping on carbohydrates or acidic and sugary drinks throughout the day, not even brushing and flossing, and not going to the dentist, then this is gonna be a really bad combination, and you might not be able to avoid getting cavities. So how can you reverse a cavity? Well, other than going to the dentist every 6 months, first of all, to check even if you have a cavity starting in the first place, the first thing is gonna be fluoride. I know there's a lot of people out there that are anti-fluoride and want to avoid fluoride. That's fine. I'm gonna get into other things you can do as well. But fluoride is gonna be the #1 way to remineralize and strengthen your teeth and reverse a cavity. The reason fluoride is so important in this case is because fluoride will not only remineralize your teeth more, it'll actually strengthen your enamel. So normally your enamel is made up of these crystals called hydroxyapatite. And this hydroxyapatite crystal is what has that trigger point of that pH of 5.5 where I talked about, where your hydroxyapatite will start breaking down at that pH of 5.5. But if you have fluoride instead, fluoride will turn this hydroxyapatite crystal into something called fluorapatite, because it'll swap out that hydroxy ion and put a fluorine ion in its place. And when that happens, the crystals in your teeth can be held more compact. And this in turn makes it a lot harder for that crystal to demineralize. So fluorapatite will now demineralize at a pH of 4.5. So now these fluorapatite crystals, or your enamel that has been in contact with fluoride, will be a lot stronger and a lot more resistant to getting cavities. And this will really be helpful if you have a cavity starting off. Then you put this fluoride in contact with it, then that fluoride will kind of strengthen all the crystals around that cavity. So one way to get fluoride is a fluoride treatment at your dental office, where they literally just paint fluoride on your teeth. It'll stick to your teeth and help remineralize your teeth all day. Or you could just use a fluoride toothpaste, and literally almost any toothpaste out there will have fluoride in it. And you'll brush your teeth, but the key here is to not rinse your mouth with water after. I know it's really tempting when you brush your teeth to swish your mouth with water after. Well, the whole point of the fluoride in toothpaste is for that fluoride to help remineralize your teeth, like we talked about. So if you're washing it away with water, then you're gonna wash away all the fluoride. You want that fluoride in the toothpaste to stick to your teeth, at least for like 15 minutes or so. You can still spit out and everything like normal, but you wanna keep a layer of that toothpaste on your teeth. Sometimes what I tell people is rinse your mouth in the morning because you have to go out and talk to people and maybe eat your breakfast or something. But before you go to bed, try just keeping a layer of that toothpaste on your teeth instead of rinsing it away with water. Now I know I talked about if you're against fluoride and you wanna get it completely away from you, I personally use a fluoride toothpaste, but if you don't wanna do that, you can use a hydroxyapatite toothpaste instead. I think this will be the next best thing to using a fluoride toothpaste. So it'll still remineralize your teeth. It'll still get that remineralizing. You still want to do the same thing of not washing it away with water. The only difference here is those crystals in your teeth, they're going to stay hydroxyapatite crystals. They're not going to turn into that fluorapatite crystal that I talked about. So your teeth will now still be demineralizing at a pH of 5.5 instead of 4.5 if they were in contact with fluoride. Some other things you can do are pH balancing products. So for example, I use a mouthwash called Carefree, which is a pH balancing mouthwash. It's a more basic mouthwash. So when I rinse my mouth with it, then it'll help restore the pH of my mouth to a more basic level, or at least a less acidic level, because like I said, the one thing that's causing this demineralization is acid. So if something's going to be neutralizing that acid, then you're going to help encourage more of that remineralizing or reversing of those cavities. You can also try adding xylitol. So for example, I like a xylitol chewing gum. The cool thing about xylitol is it's the one sugar substitute out there that actually helps prevent cavities. Everything else, sugar, along with all the other sugar alcohols, can actually still cause cavities. I know sugar obviously can, but even the other sugar alcohols can still cause cavities to a very, very small degree. Xylitol, on the other hand, it doesn't just not cause cavities, it actually prevents them. And again, going back to that mouthwash I talked about, the Carefree, it actually has xylitol in it. But you can also chew a xylitol chewing gum. So next time you're buying chewing gum, see if it has xylitol in it, and then after your meals, this will be a great time to chew xylitol chewing gum because first of all, when you're chewing gum, you're stimulating saliva. So if you chew gum after a meal, then you're gonna have more of the saliva, which again is gonna be more of a buffer, but then you get the xylitol in combination with that, and this is going to be even more beneficial for preventing cavities. Just a side note on xylitol, there was a recent study that was published that was potentially linking xylitol with cardiovascular disease. Now, I already shared my thoughts on this article and I talked about it in a different video, so if you want to watch that, I'm putting the link in the description below so you can check it out there. But something else you can do to help remineralize your teeth is just limit the snacking. I'm not saying to go full on intermittent fasting, although that will be good for your teeth. But if you limit the frequency of meals and things entering your mouth, then this will limit the amount of times that the bacteria in your mouth will release acids. Also, if you limit the frequency that you eat or drink something acidic, like limit the frequency of you sipping on juice, then this is again gonna prevent those acids from keep coming in contact with your teeth. It's way better for your teeth for you to drink a full can of Coke in like one sitting versus sipping on that can throughout the whole day. Because if you drink it all in one sitting, it doesn't really matter. All that acid's gonna be gone, your saliva is gonna build up pretty quickly, and the pH in your mouth eventually will be able to be restored. But if you sip on it throughout the day, then you're not giving that saliva time to build up, you're not giving that pH time to get buffered out. You instead keep introducing this new acid into your mouth, and that's gonna lower the pH in your mouth and make you more susceptible to getting cavities again. You can also try rinsing with water anytime you eat something acidic. So for example, if you drink your coffee and you sip on it, try sipping with water and rinsing your mouth a little bit after. You can also end your meals with tooth-friendly foods. So I made another video specifically about the best foods for your teeth, and I'm putting a link in the description below if you want to check it out. But basically, anything that is crunchy that does not cause cavities at the end of your meal would be a good thing to add. So if you just eat a cheeseburger, ending it with some lettuce or carrots, because that crunchiness can clean your teeth. And also vegetables like this don't even cause cavities. So it's a good idea to end your meals with it, because that's gonna be like a natural toothbrush acting to clean your teeth. Now you can also try oil pulling. Now I talked about this a little bit already, and I made another video again on oil pulling specifically. So if you wanna check it out, I'm putting that link too. So there's a lot of videos for you to check out in the description below. But basically what oil pulling is, if you haven't heard of it, it's you take coconut oil and you swish it in your mouth for 15 to 20 minutes. Now, why on earth would anyone ever do that? Well, it's thought to have a lot of antibacterial properties. And there is some evidence coming out on it, but I haven't really seen a ton of evidence on it. And I haven't seen any evidence saying it's better than just doing brushing and flossing. So if you're already brushing and flossing, I don't think you need to add this to your regimen. But it definitely, by all means, does not replace brushing and flossing. But if you want to try it, I don't think it hurts to try, so give it a shot if you want. Thank you guys for watching. I hope you learned something, and let me know if you're able to start avoiding going to the dentist as much using my tips. What if I told you that millions of people, including teenagers and children, are unknowingly taking part in an experiment? Vaping, which has been marketed as the safe alternative to smoking, has really grown in popularity, especially among younger people. But what do we really know about vaping and its effects on the body? Well,